Number 10. Immunologics for migraine prophylaxis.
Throbbing pain, nausea, sensitivity to light. These debilitating symptoms of a migraine are incapacitating nearly 38 million Americans, an estimated 12% of the adult population. Sufferers are forced to call off work or cancel plans, taking a toll on quality of life, career, and finances. But now, the arrival of a new class of medications is providing relief through the prevention of migraines. The drugs work by blocking the activity of a molecule called calcitonin gene-related peptide, or CGRP, which spikes during a migraine, causing brain inflammation and pain. Given once a month by injection, clinical trials showed a reduction in headache days per month when compared to placebo. Today, 3 CGRP inhibitors, as well as the first ever intravenous CGRP inhibitor migraine prophylactic, are FDA-approved for both chronic and episodic migraines. Currently being prescribed with no signs of slowing adoption in 2021, these new treatments are helping countless migraine patients head off pain and reclaim their personal and professional lives.
Hi, this is Akhil Saklecha from Cleveland Clinic Ventures. With me today, I'd like to introduce Dr. MaryAnn Mays. She's a staff neurologist at Cleveland Clinic and also director of Cleveland Clinic's Neurology residency. Thank you for being here. Today we're going to be talking about the CGRP monoclonal antibody and its relation to migraines. Tell me a little bit about this class of drugs, especially as it relates to the prevention of migraines.
Right, so the CGRP monoclonal antibodies are antibodies against the calcitonin gene-related peptide. It's an exciting time to be in headache medicine. It's been years since we've had any type of new therapeutics to treat this disorder. These drugs were designed specifically to treat migraine, which is unique. Most of our other medications were not designed to treat migraine. CGRP was found to be an important molecule back in really the 1990s. And then it took a long time for it really to come into market to get a drug that was therapeutic, looking at kind of the biology of migraine. If you take a look, a lot of what we've been able to develop for therapeutics is really based upon our understanding of migraine pathophysiology. And it's really our understanding of the disorder that has led to such great improvement and some benefits for patients. CGRP is a neuropeptide. It's very important for both in the peripheral and central nervous system. It's a potent vasodilator. It also produces neurogenic inflammation, mast cell degranulation, and also is important for pain transmission. And it's those mechanisms which are so important for migraine. And so these new CGRP monoclonal antibodies target both CGRP and its receptor, blocking the ability for the trigeminal nerve to release those into the meningeal blood vessels, and thus preventing the development of migraine.
So is this for every patient with the migraine, or are you selecting these patients that you give this to?
No, that's a good question. These medications are once a month injections. Because they're newer medications, there's obviously a cost associated with them. But for people that with migraine, the disability is very high. And so we're using this in patients that have failed other preventative therapies that have been on the market for a while. Typically, most insurance companies require patients to have failed 2 other preventative therapies. And we generally will pick people either with episodic migraine, meaning those less than 15 days a month, or those with chronic migraine. We know that people with chronic migraine all should be on preventative therapies, but certainly there is a good proportion of people with episodic migraine, probably 40%, that also should be on preventative therapies. We often think of people that have probably more than 4 migraine days a month should be on some form of preventative therapy. We know if we let patients go on longer, and as they get more and more frequent with their headaches, they run the risk of developing chronic migraine. In fact, 3% of the population turn in to have chronic migraine each year. And we know with chronic migraine, there's greater impact on disability, other comorbidities for the patient, and they're just harder to treat.
That's true. So what benefits are we actually seeing in the use of these drugs, and how is it impacting patients' lives? Because these migraines in general are so debilitating, as you said. Patients can't work, they can't function at home. Are we seeing that improvement and benefit?
We're definitely seeing that improvement and benefit. It really, when they first came on and we were starting to put patients on this, walking into each room, I felt like I was really making an impact on patients' lives. The patients have noticed that they're, even patients that have been very resistant to preventive therapies in the past. In fact, they've done clinical studies, regardless of whether someone's been on 2, 4, or 6 other preventative therapies, and patients that we previously said they were refractory, where we had nothing else to provide these patients, we are now able to give them these therapeutics where they notice, for many patients, a 50% decrease in their headache frequency. And for some patients in the clinical studies, it was 2 to 4 headache days a month for episodic. For chronic migraine, 4 to 6 headache days less a month. And although that sounds like low numbers, if you decrease 4 headache days a month, over 12 months, that's a whole month living without a migraine. So that has a huge impact. And we're also seeing that patients also are noticing that their abortive therapies are more effective, or they're not using as many. And so they're not missing out on going to work, missing out on family activities. There's just one little story. My favorite patient of all time, she was started on this, and she was a really tough to treat headache patient. She's about in her mid 50s. And she came back to me and she said, if I had had this medication when I was in my 20s, my whole life would be different. I would have gone to college. I would have had children. She said it really would have been a game changer. So, hearing those stories is really so impactful.
Absolutely. And I think that's really the benefit of such a medication like this. Well, Dr. Mays, thank you very much for your time. We appreciate it.
Oh, thank you so much for having me. And, I'm excited to bring this medication out and make people aware of it so we can increase the awareness of migraine as a significant disease that affects many Americans.